Okay to talk?
Yeah.
Okay. What's very important, especially here in the mountains of Ecuador, is warmth for the patient. And I have a standard hair dryer here that warms the tissue very, very quickly. Okay. We've had tremendous success with Victor since last year. We're seeing more and more muscular control and relaxation of his muscles. And the therapies that I'm going to show you tonight, I've enhanced them from other therapies. They're very aggressive, but this is a very strong man, and he can handle the type of therapy that we're going to do tonight. So you can see the slight spasm when the warmth is put on the legs. A year ago, his legs were all in this position. For 2 years, both of his legs were contracted. And we had to work with the hamstrings and the quads. Nerve, which is what moves the legs back and forth, is L1 to L5, and then the tip of L1. And I can run these in either in the low speed or the high speed. By the way, my name is Doc Mike Witort. I'm a reflexologist and a doctor of functional medicine. I've been all over the world with my therapies. In Chicago, I was put in jail for helping people. I was violating a statute that you can't help somebody without drugs, without surgery, and without a medical license. Spent some time in jail and on probation. Little history. And I finally beat the state of Illinois in my last case and have 28 felony conspiracy with intent charges against the state. And I've been free now since February of 2012. And so this next short piece of this video you'll see is a very aggressive movement of the legs, getting them out of spasm and exercising the contractions and the relaxation of these major muscles. There's 16 muscles here that have to coordinate with the spine and with the brain. And this is an enhancement that has helped Victor relax his legs by challenging the spasms that may occur. Okay? One of the things that I found is if we pronate the toes off of the ankle, there's much easier access to relaxed muscle. And I also run these two wands at the same time to relax the muscle fibers. And then we go back and forth, just like this. And up the calf to the Achilles tendon, The reflex for the knee and the hip is right here. Run it on that. And you can see how easy it is to move the leg back and forth, exercising both the hamstring muscles, and the hamstring muscles and the quadricep muscles. I can turn him over and run it on the quads, and then extend and flex from the knee. As you can see, he's had some surgery here. There's been some major reconstruction of his hamstring muscles after some surgery. And then I speed up the movement with the relaxation in the lumbar area. You see? Papi, you gotta tell your daughter that everything's okay. She's gonna cry. Okay. Reflection, extension, flexion, extension.
Nie? Czy? Nie, co to?
I'm gonna trick that other leg. Do the same thing. I usually try to have this therapy last about a half an hour. It's a little bit tedious, but I've seen such tremendous results. And Victor's will to be walking again. Because his doctor said that after his neck was broken, he wouldn't move his arms, he wouldn't move his legs, he wouldn't be able to walk. Well, it looks to me like we're well on our way to getting him walking again. And I want to thank Victor and his family for trusting in me to do these therapies. And I've got a whole book, 500 pages of therapies for my patients, and I'm sharing them with Victor, and I'm sure that his family is very enthusiastic too about his treatment. Okay, okay.
Yep.
It's okay, honey. What's your daughter's name?
No,
Anna? Anna?
Llevo.
Anna? Is it Anna?
Digo.
Okay, I'm done.
¿No que se qué dijo?
Yeah, we're finished.
yeah, padre, como decía.
Yeah.